You might think Lyme disease always comes with a big, obvious target-shaped rash, but what if I told you that for some people, it doesn't show up that way at all? That could mean a misdiagnosis and long-term health problems. Hi, I'm Dr. Mickey from the Health and Wellness team here at UB Health. As the AI face of UB's global network of over 1,200 medical providers and backed by insights from more than 12 million users, I'm here to help you separate fact from fiction. With so much misinformation floating around online, it's more important than ever to get doctor-approved info you can actually trust. Today, we're breaking down the early signs of Lyme disease, what to look for, what not to panic about, and how to protect yourself this tick season. Lyme disease is caused by the bacteria Borrelia burgdorferi, usually passed to humans through the bite of black-legged ticks, also known as deer ticks. While cases can occur year-round, it's especially common in the spring and summer. Think outdoor hikes, tall grass, and camping trips. Ticks love warm, humid environments and often crawl up from your legs before finding a good spot to attach. Now, one of the first and most telling signs of early Lyme disease is something called erythema migrans, that classic bullseye or target-shaped rash. But here's where it gets tricky. Not everyone gets it. In fact, up to 30% of people infected with Lyme disease never develop a rash at all. And even when it does show up, it might not look anything like a textbook bullseye. I remember one user in the UB Health system who came in thinking she had just a regular bug bite, small red area on her thigh, not painful, not itchy. But a few days later, it had grown to the size of a grapefruit. That size, more than 5 centimeters, is actually a key diagnostic clue. Most rashes associated with Lyme are large, red, or pink and expand gradually. And unlike other skin reactions, they usually don't itch or hurt. So even if the rash doesn't look dramatic, pay attention if it's growing. Document it with photos, mark the edges with a pen, and keep track of any new symptoms, especially flu-like ones like chills, fever, body aches, and fatigue. Those can start appearing just days after a tick bite. Now I want to clear up another common confusion, southern tick-associated rash illness, or STARI. It causes a rash that looks a lot like Lyme disease, but it's less likely to cause long-term complications. It's spread by the lone star tick, which, interestingly, has a white dot right on its back, almost like nature's little warning label. Unlike Lyme, STARI tends to stay in the early stage, fever, fatigue, and rash. It doesn't usually move on to joint pain or neurological issues. Still, differentiation can be tough without a doctor's help, so don't hesitate to get a professional opinion if you're unsure. Speaking of complications, untreated Lyme disease can lead to arthritis, especially in the knees, and less commonly, to facial palsy, meningitis, or even heart issues like heart block. I had a case last summer where a patient brushed off their chills and rash after a hiking trip. A few months later, they were dealing with severe knee swelling. That's why early detection is so critical. Here's what you can do at home. If you've been in a wooded area, do a full body tick check. Don't forget behind your knees, ears, and even the scalp. Ticks need to be attached for about 36 to 48 hours to transmit the bacteria. If you find one, use fine-tipped tweezers to remove it as close to the skin as possible and pull straight up. Then, watch that area for changes over the next few weeks. You can also track symptoms with a journal, note fatigue, headaches, joint discomfort, or any unexplained fever. And natural repellents like eucalyptus or lemon oil can be helpful, but for serious prevention, stick to EPA-approved bug sprays that contain DEET or picaridin. Worried about your own health? Start by checking in with a UB symptom checker at ubhealth.com. It's medical grade. Doctor-approved AI is like having a full on-call healthcare team right in your pocket. Always 100% free. Like and follow for more doctor-approved info you can trust from UB Health. Stay safe out there.